died of COVID. So far in August, over 400 deaths already, and there's still a week left in the month. Dozens of people dying every day. In late May, the positive rate of tests coming back was under 1%. In June, it hovered at 1% before a steady climb. It's now close to 7%. As the deaths mount and the infections grow, questions continue to swirl over Israel's response to this punishing fourth wave. And with us now is Professor Talya Miron-Shatz, the founding director of the Center for Medical Decision Making at Ono Academic College. Professor, thank you so much for being with me. There's a lot of concern now about kids going back to school in less than a week, especially young kids and preteens who are not eligible for vaccines. Do you think the reopening plan is advisable? Is it safe? What are your thoughts?
I think we have to balance two things, and none of them is great. One is sanity, routine, children's welfare. The other is health. So with health, we know we have COVID and we have the numbers. They're not looking great, but we've got to remember we now have the vaccines, number one, number two, number three. People can protect themselves much better against COVID. And even if we see numbers of people with COVID, what does it mean? It's not binary. You have COVID, that can mean you have it mildly. And if you've been vaccinated, you will have it mildly. So I think that's the first priority, is to get as many people as possible vaccinated. That can also help kids, because then fewer people will be infected. So I really commend and salute the government, and that's, not an easy thing to do given the complicated reality, for saying we're going to balance this out. We're going to give parents some certainty. We're going to give kids some sort of routine. But this is really on us in terms of protection. There's not going to be complete protection.
Yeah.
Lockdown is just a bad option.
Professor, I want to ask about the booster campaign, which is underway now and very important for this government to hit a benchmark, they say, of about 5 million booster third doses. Why that number? And is the booster campaign alone, could that bring an end to this fourth wave?
So I think the booster campaign is brilliant for two reasons. One is we were all looking at the looming holidays in terms of lockdown. It's going to be terrible. Then came the booster and said, there's hope. Don't go into learned helplessness. Don't say, whatever I do is not going to help. I'm going to be stuck at home for the holidays. Do whatever you can to prevent that. So we are trying to get learned helplessness out of the way. And with this number, it's brilliant because it provides an anchor. That's a very important concept in behavioral economics. When you have an anchor, a number, something you strive for, it's much easier to achieve this goal than when you say, I'm going to lose a couple of pounds. What's a couple? It's 1, 2, it's 7. How many people do you want to vaccinate on the third wave? 5 million. I get it. We're not there yet. Did you vaccinate? Did you? Now pushing. I actually think we are running into another problem that's rooted in psychology. And that's the fact that the government has been so good at delivering vaccines. So we can say, I can always get it tomorrow. We don't have this urge. It's not like a Macy's Super Saturday sale. You feel the urgency to go or it will go away. It's called scarcity in persuasion. We don't have that. Yeah. So barring scarcity, you have to have another mechanism. And I think this anchor at 5 million, it's rooted in medicine, but it also is a very potent psychological drive.
Yeah, psychological campaign as well to get people to get these shots in their arms. Professor, thank you so much for being with us.